Hi, I'm Faye and this is the ICU at Alice Springs Hospital. The plans for this patient.
It's a 6-bedded intensive care unit with 4 HDU beds and a designated neonatal room.
We have about 1,000 patients per year come through here.
We have every age group. We have neonates, paediatric clients, adult clients, coronary care clients, surgical patients and medical patients.
The average age in intensive care here is 45 for Indigenous and 55 for non-Indigenous people.
Well, it's quite a small unit, but it covers quite a large area. And people you get here you don't get anywhere else in the country. It's very unique sort of sample clients we get here.
The fact that this unit takes every age group, we get international clients, so unfortunately our tourists that roll their vehicles over come to us. We have lots of car accidents out because of our roads. They're not used to the driving conditions, and so yes, it has to take everything and anything that comes in the door.
This unit is different because of its isolation. It's 1,500 kilometres to the next nearest large hospital, which is Adelaide and Darwin.
Oh, it's totally different. Number one being the Indigenous population is fantastic to work with. They have unique problems, unique medical histories.
Well, basically the high rate of chronic disease, I suppose, is different here. And the age of the population, you get a lot of younger people here.
Indigenous people have a lot of comorbidities. That means that they have a lot of other conditions when they come into hospital.
Mostly get a lot of pneumonias and things like that, surprising for like a desert environment, but yeah, and get a lot of alcohol-related diseases as well, and a lot of renal diseases, diabetes-related diseases as well.
English is not their first language, so there's other languages like Warlpiri, Aranda, Pitjantjatjara, things like that makes it difficult to communicate with Aboriginal people, and it isn't widely known that English is not often their first language.
A lot of challenges is just the cultural sort of barrier, you could say, between the Indigenous people and us. But you get used to the culture and what they're used to, and you get to learn a lot about the Aboriginal people.
Palya means all right. Common question, have you passed urine? Urine is kumpu. Have you had your bowels open? Guna is bowels. So they're some of the most common ones that we've used.
It's unique in that you've got a very sick population, you've got communication issues, but then it can be a really beautiful thing when they teach you something. So the learning is often both ways. So their interpretation of their health, the struggle to try and get them to understand their health conditions, and the importance of looking after themselves when perhaps culturally they've not ever done it before.
So Richard, you've got some family up in Punya. You say you've got your uncles and your nephews out there. Can you hear me, Richard? No, I was saying before he had some family at Punya up there, and he said he's got his uncle.
My role is an Aboriginal health worker in ICU. I advocate for Aboriginal people understanding their language groups, where they come from, and just doing cultural advisory throughout the unit. Solely because you're giving them an understanding of what they're not understanding. It's just like someone going into another country, who's not a speaker of that language. You're going in there and you're interpreting, or you're explaining to them the medical jargon, also their rights and responsibilities, and just explaining to their family.
You wanted to go back home.
Yes,
because it's a sorry business. Yeah.
Yes.
So we've got a Fran, who's a Aboriginal health worker here. She's going to talk to you about that because that's women's business.
Probably communication is the biggest one. We have to make sure that we actually use the Aboriginal liaison officers and interpreters to make sure that what we're saying is actually understood by them. Trying to explain their disease process, trying to explain to their families how really unwell they are, trying to deal with the death and dying process. And as a unit, we do that very well. We allow the traditional healers to come in And so we often have to explain to our new nurses that the nunkery is part of the traditional cultural practice. We have to make sure that we allow them to grieve, particularly in ICU, and to sort of embrace the cultural differences that we have. Yeah.
Different language, different cultural issues might be things like men's business. So you may have a female nurse trying to attend to a male Aboriginal person, and basically that's a no-no. Say we might have a critical patient, they may have the chance of dying, so we need to know that they understand the Natural Death Act, and being legal jargon, we need to interpret that into their own language, as well as make sure they understand exactly what it is and that they agree or not agree with it. Plenty of times you'll find that, not here, but I've heard of other cases where patients aren't aware of that. So they've just said yes to what they think is the Natural Death Act, and they have no understanding of it.
What's the Natural Death Act?
Natural Death Act is, say if you're in a critical position, you stop breathing. Natural Death Act is they don't attempt to resuscitate or anything like that.
If a patient is critically ill and possibly is dying, then we have had prayers with up to 50 people around the bedside here. And I think that's what makes us unique, because we cater to the patient and the family's psychological and social well-being. And so we've had some very nice end-of-life ceremonies here where about 50 people have partaken.
Some sort of cultural taboos you don't go near, like you see body scars on people and you tend not to ask where they come from or what they, or they're all very different. There's different things about the body, especially males' bodies, that are there, like different circumcisions that you get used to very quickly. You don't tend to ask how they got them or things like that. You can tell that men have been initiated and things like that.
So this is our neonatal room here, and this is a bed set up for a baby if they should need to come in here.
Are they mainly Indigenous neonates?
Predominantly, yes, they are.
What are
Yes.
their specific needs?
They're often born premature, up to 10, 12, 14 weeks early, and so they will take a lot of care in here being so premature. But they tend to be a little bit lighter than non-Indigenous babies, and they're often a little bit sicker.
Why are they lighter?
Generally due to poor antenatal care, and sometimes lack of nutrition from the mother.
Have you got a memorable?
Most memorable experience, I think, would be looking after an elderly Aboriginal man who we were really struggling trying to explain about his sick heart. And we showed him a video that the Australian Heart Foundation has on getting better after your heart attack. And there was some white fellas riding around on bicycles, and he just started to laugh, and his laughter was so infectious. And he says, "We don't have bicycles out bush." So that once again highlighted to me the inappropriateness of a lot of our resources in dealing with Indigenous clients.
Sure you're happy.
Thank you very much. Yes.
It's ever changing. There's all sorts of new diseases coming through.
And Janice, it's a great place to work. It is very friendly. People support each other, as in staff-wise. The doctors, the nurses, allied health, Aboriginal health workers, all support each other. And so I'm still here because basically can't find a better place. Always challenged on a day-to-day basis.